I am happy to be here this evening. I hope that everyone is finding a comfortable spot, finding something, a cozy place to sit, maybe a hot cup of tea or coffee if it's not too late, or just be cozy. I think that was kind of I hope the theme for tonight. So we're going to go ahead and get started. So I'm going to talk tonight a little bit, or today a little bit about the intersection of mental health and physical disease or physical health. And I'll kind of really focus on multiple sclerosis because that is the disease that, that brings us here together for the MS Mental Wellness Chat. So we're going to move on to the next slide. And thank you so much to Viatris for their support for tonight's program. And also thank you to MS News and Views. Without this idea to have this MS Mental Wellness Chat, we would actually not have it. So 3 years ago, Stuart and I and Jennifer decided this is something that was needed, and we have been doing it, and it's been here ever since. So tonight's chat is going to be about MS and mental health, and then mental health and MS. So we're going to talk about it from different perspectives. We are going to talk a little bit about tools to help manage and cope, and we're going to talk about talking to your healthcare team. We're also going to communicate with each other in between the program as well, and I will ask questions and kind of guide us in conversation. So we'll move on to our next slide. So MS and mental health, or is it mental health and MS? And that is the question. You know, a long time ago, I remember asking my own neurologist if, and he is an MS specialist, but I said, do people have depression with MS because they have MS literally, or because of the MS organically? And so the relationship between mental health and chronic illness and disease is very unique. And I'm going to talk about some points that are important to consider. And they're going to be generalized points, but very true for MS as well. So we're going on to our next slide. So a few facts to consider about physical health and mental health. So I felt like that these were important to read and to share with you. So physical and mental health are they're intricately connected. So they really influence each other. So having stress and mental health challenges makes it harder with your MS. And so it's hard to know that, or it's important to know that they interconnect. So poor physical health can lead to mental health issues, such as depression and anxiety. And this is very, common with a chronic disease, as well as someone that is living with a acute illness as well. So similarly, mental health problems can manifest physically, sometimes leaving you to experience symptoms like fatigue, muscle tension, and even chronic pain. The brain and the body communicate through complex pathways, and we know this because of MS, but with neurotransmitters and hormones playing crucial roles in regulating both physical and mental health. So the brain and the body are complicated, but they're also interconnected. We know that regular physical activity has been shown to improve mood and reduce symptoms of anxiety. And this can help reduce depression, and also highlighting that there's a strong link between physical activity and mental well-being. And nutrition also plays a significant role in both physical and mental health. Chronic stress can have detrimental effects on both physical and mental health, and can increase the risk of developing other conditions or comorbid conditions. Sleep is essential for both physical and mental health. And with poor sleep, quality is linked to increased inflammation, impaired cognitive function, and mood disorders. So I'm going to read more of these in a little bit, but I'm going to put them down for just a second. And we're going to go on to our next slide. So I wanted to open up the chat. Do you experience changes in how you feel mentally related to your physical health? Linda, I'm going to ask you, is it okay if I read that out loud first? So, and I believe that Linda would have said not to read if first. But while we're answering the question, do you experience changes in how you feel mentally related to your physical health? I've got Linda that shared something. A high school friend died unexpectedly in her sleep the other day. I cannot believe how grief instantly messed me up physically all day. Any way to prevent that, or just process the grief and go through it? So, Linda, this comes at a really interesting time for me as well. So I think it's good to add into the conversation. So many of you know my dog Bella, and because Bella has sat in onto the mental wellness chat since the beginning of it, actually. And Bella passed away. I had to make a decision to put her down in last week. And grief is so hard, and grief is so complex. And grief is really inescapable. We can push it away, or we can lean into it. And so I allowed myself to lean into it. But it's hard because it does mess you up pretty physically. You know, my fatigue level was off off the charts, super high. I also was super sad, and I wasn't thinking. I could think clearly, but but my cognition wasn't the best. But it was kind of like a really bad cognitive day or two afterwards. And grief is one of those things that can do that. It can change how you feel. And I've talked about grief in the past, but I think it's important to lean into it and to find ways to cope, but to also not beat yourself up if you're physically not feeling well, if you're grieving, because sometimes that's what happens. So I'm going to answer some of these. Okay, so do you experience changes in how you feel mentally related to your physical health? So we have Carol says yes, Sherry says yes, Boylan says yes, Linda says yes, Julie says no. Carol says, if I don't exercise, I don't feel I have the energy or strong physically. And we have Paula that said, I had something happen last month. I lost my niece in a tragic accident after I lost sight in my left eye. I need to learn ways to handle this type of traumatic things so I don't have things like this happen. And this is a really hard thing that life is going to continue to happen around. And sometimes beautiful things happen, and a lot of really hard, bad things happen too. And finding ways to allow yourself to cope and to process and finding ways to deal with the sadness, the stress. Sometimes we can't prevent those things from happening, but we can prevent or we can manage how we allow ourselves to process them, and that's really important. We have Michael that said, yes, my physical health brings down my mental health. Paula said she is sorry for your loss. We have Boylan that says 5 years a loss after a loss of a soulmate, going through therapy and grief groups. Nothing seems to help with mental health and some physical issues. Kania says, I don't think so. I have self-esteem problems whether I'm exercising or not. And Boylan says I went from mindfulness to mindlessness. So there, it's hard when you're going through grief, when you're going through changes, and when you're dealing with stress. I will share this out of vulnerability. I have a nephew that's in intensive care right now. So I lost my dog last week, and I have a nephew that's in intensive care right now, and he's not doing well. And how can you navigate something that's really hard and not and stressful and sad and difficult, and it's and you can't control it. You can't control what's happening. The only thing you can control is yourself. And so sometimes it's allowing yourself to walk gently through things. Know that, and Paula just said, it seems we need all the answers. It sounds like I think we all do. We just can't control it, right? It can be really hard. And bad things are going to happen and hard things are going to happen. So what are things that we can do? I will share, just because I know that therapeutically this is a very positive thing to do, and helpful thing is, while I can't control what is going on with my nephew, and I can't control what happened with my dog last week, what I can control is how I'm looking at the world. And so today, we went walking around somewhere, and I stopped and I took pictures of random flowers. And that was really helpful for me. Taking pictures of little beautiful things that I saw. It drives my family crazy because they don't understand why I do this, but I do it to kind of focus in on seeing kind of the beautiful things. I also brought art supplies with me. So for those of you that like cats, I'm continuing to learn how to draw cats. And and so so it's important to know that we don't have all the answers. That grief is something hard and something that you have to walk through, and it can take a long time. Sometimes grief is easy, and sometimes grief is hard, and it can last a long time. It's important to seek therapy from a counselor if the grief is going on for a long time, and at the same time, if something happens and it creates a lot of internal stress, it might be good to see a counselor to help process. But at the same time, it's not your fault if things have happened, and you end up having a MS relapse. Like, I don't want you to blame yourself. I do think it's good for us to have tools to manage stress, because stress and MS don't go hand in hand. So Michelle, let's see. We have Julie and Julie said that she is sorry for the loss and praying for my nephew. Thank you. And so and Linda, we have a lot of I'm sorry for your loss too, and losses happen, and I'm sorry for Paula's loss as well. So when we experience changes, and so we'll move on to our next slide, because I'm going to flip this question just a little bit. Do you experience changes in how you feel physically related to your mental health? So I think the grief example is actually a really good example here. So I will lead us off here. So yes, when I was feeling a very deep sense of sadness and worry, but sadness last week with Bella, I felt completely tired. So it physically really bothered me. But then also when if I am feeling symptoms of anxiety, which happens sometimes, um, you know, I can be more fatigued in general, because that's an exhausting experience for me. So we have Paula that says definitely. So do you experience changes in how you feel physically related to your mental health? So you might notice that if you're having anxiety, depression, or mood disorders, that you may have experienced some physical symptoms. So we're going to take my video off, and I hate that, guys, but I want what's best for you, and it's so hard when the voice isn't matching up, and so I want to stay focused. Okay. Linda says, anytime I'm emotionally distraught, it always happens. So it can be a very common thing, but you can see how the physical and the mental kind of like play off of each other. And I think that is an important thing to note. And we have Mona that says emotional stress triggers my MS. And that's something that we can see that's very common sometimes. Paula says, I was trying to be there for my sister and her son, and it was days of stress, and she was exhausted. So you could see that sometimes the emotional stress can trigger. So Cindy said all these factors are in her life right now, and that's overwhelmingly stressful, and it actually brings on panic attacks I've never experienced before. And this increases all the worst MS symptoms. So if you have a great sense of stress in your life and things that are causing anxiety, causing panic, and you know it really increases, you know, the symptoms, I am going to encourage, you know, to talk to someone, because your quality of life is so much better when you can feel that you can manage and have someone to talk and process with it. So I'm going to encourage that for you, you know, and because life is hard, and like I always said, things are going to happen, good and bad, and sometimes things are totally out of our control, and we want to maximize as much self-care as possible, and also to maximize our coping skills. So we're going to move on to our next slide. So the connection between disease and emotions. So having MS, you know, can cause, you know, we've talked about in the past, mood changes, or even mood swings, even depression and anxiety. It is very common to have, with MS specifically, to experience either depression or MS. Now, that doesn't mean that you are guaranteed to experience this. It just means that it is common. I always say I have anxiety like I have brown eyes. So it's just a part of me. It's managed, but it's a part of me and my MS journey. And before my MS journey, I did not have anxiety like this. I was generally anxious, but did not have diagnosed anxiety. So we have Kenia says, when I'm feeling anxious, my muscles feel more tight and it's hard to move around. So kind of that's a good example of like how you physically may, you know, when you're feeling a certain way, how it may affect you physically. So MS can raise your risk of emotional instability, you know, which I'm trying to think. So we talked about this before in the past, but there is and just kind of like the mood instability, and you know, therapy, medication, and really talking and strategies can help with this. Your you can really have a wide variety of symptoms though, due to MS. So we're going to talk a little bit about the prevalence of mental health issues in MS. So as I had shared earlier, that it is not uncommon to experience some level of mental health changes as a result of having a chronic disease or having a disease like MS. And there's a couple reasons why. We're going to move to the next slide, and we're going to talk about like factors that contribute to the mental health symptoms. And we have Linda that shared, I was always a moody girl way before MS, and anxiety came after. And Dion says, being aware of my mindset has been a game changer. That is so true. So factors that are contributing to mental health issues in MS. So with MS, the disease is unpredictable, and you know, with life, some of life is unpredictable as well. But having a disease that you can't guarantee what it's going to do. You can't guarantee. You can kind of see trends with stress, etc. But it's hard to live with a chronic illness. And then there could be symptoms such as like fatigue, pain, and cognitive difficulties that can also challenge mental health. And then there are, potential roles of neuroinflammation and neurodegeneration in MS-related mental health issues. And so I'm going to share a little bit more of some of these points that I thought were really helpful. Is that so chronic stress can have detrimental effects on both physical and mental health, and it can, increase the risk of other like comorbid conditions. We also know that social connections and support systems play a vital role in both physical and mental health, as isolation and loneliness can have negative effects on aspects of our well-being. We have I have Paula who said, I used to journal, but I lost my vision in my reading eye, so I can't journal right now. So Paula, I'm going to give you a recommendation, but I'm going to actually ask the group to chime in too. Journaling is so good, especially when you can, write with your hands and sort of get it all out. There might be a way that you could do a verbal journal where you articulate through your phone temporarily. And there are like journaling apps that keep everything locked up. And so I just wanted to share that if anyone, okay, so Krista says audio journal. Dion said, dictate your thoughts. And Paula said, oh, nice, thank you. So perfect. I want you guys to always chime into the chat because these things happen, these really great suggestions. So chronic illnesses such as cardiovascular disease, diabetes, cancer, can impact mental health by causing emotional distress and reducing quality of life. So when you think about some of the statements, that I've been reading, you can see how MS is connected. And then we have Sherry who says PBA contributes to my mental health. And so PBA is pseudobulbar effect, sorry. And that can be, it's a challenging diagnosis sometimes because your emotions that you have are not really congruent with how you're feeling. So it can be confusing to one, to yourself and confusing to other people too. Sherry, if I'm articulating this right, please share. If I'm not, let me know how it helps, or how it's different. But with pseudobulbar effect, which can happen with MS, is that you can have a sense of sadness, but actually display laughter, or display a lot of crying in moments that are not essentially sad. And so Sherry said mostly crying. So this can really impact how you feel socially and impact a lot of interactions and even internally, because that's a confusing feeling. And so I'm going to continue on. So mental health disorders such as depression and anxiety can affect your physical health by weakening your immune system and increasing the risk of developing chronic conditions. So treating mental health is equally as important as treating the physical health as well, because the mind and body connection is evident. And, it's important to think about the importance of things like mindfulness practices such as meditation and yoga, because those things have been shown to improve physical and mental health by reducing stress and improving your emotional well-being. And then the gut-brain axis is bi-directional communication between the gut and the brain, with the gut influencing the mental health and vice versa. And I know we have heard a lot about gut health over the years, but it's important because the gut-brain axis is, really does connect with MS as well. And then we have, for those of you that may have experienced adverse childhood experiences, This may have long-lasting effects on both your physical and mental health, highlighting the early intervention or highlighting the importance of early intervention and support. And there's a really great book. It's called The Body Keeps the Score. And this book highlights the role of how trauma can impact your physical health and your well-being. And he even highlights in the book a little bit about neurological disease. It's a very interesting book. It's called The Body Keeps the Score. And we have Krista that said a mild cognitive decline has affected my mental health. And she said, just got that book. I haven't read it yet. Paula said, yes, I have that book. It's very good. It's a very, very good book. And so it's important to know, I feel like that book is a really good book on if you've experienced trauma, et cetera, that you can kind of see how that plays into some of the physical symptoms that you may be experiencing or disease, et cetera. So we're going to, so there's changes from the emotions of having MS. So, with having MS, it is not uncommon to experience, anxiety, and this can be about the worry and the fear of what's possible, MS can make you feel anxious about what might lie ahead for you and your loved ones. It may make you feel edgy and kind of cranky. But it's normal to worry sometimes. But talk to your doctor if you're experiencing anxiety and it's getting out of control. Grief. When you're first diagnosed with MS or you have changes in your MS, you might notice that you have grief that kind of shows its face. And then also we spoke a little bit about that grief as a part of life as well. And that's an important thing too. That grief is something that's going to play out through the stories of our lives. And so with MS, grief, it plays an active role as well. I'm going to get the author for The Body that Keeps a Score, and hold on one second. And his name was a little bit hard for me to remember. Okay, so it's Vander Kolk is the last name. So Bessel is the first name, Bessel. Van der Kolk is but if you put in the book title, The Body Keeps the Score, into Google, it will come up. And so, and they actually, and Paula's right, they have a workbook that is great too. Dion says, I think I'm beginning to recognize some cognitive decline, and I try to extend grace to myself. I think that's one of the best things that we can do for ourselves is to extend grace, and because I think when we don't, we make the problem worse than it is. I think sometimes, it can, now if you are concerned about cognitive changes, it doesn't hurt to get a neurocognitive testing done. Talk to your doctor as well, talk to your MS specialist. But it, and seeing a neuropsychologist might even be helpful because it could help with some strategies. I also even had heard before that there was a MS specialist that shared this, and I thought this was fantastic. That sometimes getting a speech therapy consult can be helpful because they can help with some levels of cognitive. I remember that from when I was working with Parkinson's disease as well. But yeah, I think giving yourself grace and extending yourself grace, no matter where you are. And then we have Carol that says, feeling alone in my MS journey and worrying about retirement without real support from your husband emotionally. That can be very, be quite a weight. And let's see. And Krista says, I'm having a hard time giving myself grace. I don't think I know how. So please, and Dion said that it's a great book. So The Body Keeps the Score. I'm glad that many of you have read this book because I think it's a fantastic book. And if you're, how do you, for Krista, how do you give yourself grace? Let's share. I know for me, I have to be very intentional and I have to like not beat myself up. If I'm feeling tired, I don't allow myself to say mean things to myself. And Kenia says, I tend to be hard on myself for not being able to do what I used to. I don't want to be accused of using MS as an excuse. And I think that many people, Kenia, go through that process, where they're balancing, okay, the idea that maybe I'm not able to do what I'm used to, but I don't want to use MS as an excuse for things. And so how can I give myself grace when I can't do some things? So if I have people on here that are that have been living with MS for a long time and have some tips on giving yourself grace, how you do it, please let's chime in. I know how I do it personally, but it can be a very challenging thing. And I think how we talk to ourselves is really important. So I usually will change the narrative. And so if the narrative and I can bring reality in too, is it's sometimes the reality is that day to day can be a little bit different, or the reality can be is that there's other circumstances, and also knowing that you do the best when you can do your best is can be helpful. Let me see if anyone. Okay. So Dion has some great suggestion. I try to focus on what I'm capable of versus what I'm not. That is so great. And Paula says, I tell myself it's time to rest and it's okay to rest. Linda says, I give myself positive affirmations. I use those in therapy all the time when I was doing therapy full time. The positive affirmations can be so helpful. And Dion says, well, I have limitations. I'm not limitless. I love that. So I'm going to say that again loudly. While I have limitations, I'm not limitless. So that's a really good thing, Kenia, that might help to balance that a little bit. So we're going to move on to our next slide, and maybe one more. Okay. So there's changes due to MS and the damage in the brain. So this was the part of the question I had asked about my doctor, or asked to my MS specialist doctor a long time ago. So, do people have depression because there's damage in their brain? And so often it's more of a response to having the disease, but your brain's frontal lobe, which is really just behind your forehead, helps to control your mood and how you express your emotions. So MS lesions can damage this part of your brain. That can make you, potentially have some, behavior differences. It's not as common, though, to have frontal lobe challenges. Often you would see like frontal lobe dementia and other diseases, and frontal lobe challenges in other diseases. But another form of damage is the pseudobulbar effect, which we were talking about, the PBA. About 1 in 10 people with MS might experience the pseudobulbar effect. And in rare cases, lesions in your brain can cause euphoria. And in this case, you may seem to be overly happy when circumstances seem serious, or you may not feel worried about big problems. And so sometimes there can be kind of like PBA, where there's it's discongruent with how how you're feeling. But these are not as common, but they do happen. So that's important to know. And then, the impact of MS or your mental health on MS symptoms. So we're going to move on to our next slide. So we know that stress and MS don't go hand in hand. And we also know that, when mental health is unmanaged or not taken care of, it creates difficulty for you to be the best version of yourself. So when I say mental health, I want to think about like emotional wellness. And one tip, one strategy, one thought is that, what is something small I could do today that will help support my emotional wellness? That might be a good thing to ask yourself. That might even be a really graceful way of giving yourself grace. What is something that I can do today to support my emotional wellness? And that might be taking a rest early. It might be taking a walk. It might be calling a friend. It might be like I did, painting a little cat on a card. It could be a lot of different things. But what are some things that can help? It might be practicing yoga or going to the gym. When I say going to the gym, I just really mean any type of exercise that just feels good for you, that you enjoy. We have Julie says that she cries a lot. So sometimes, crying is can be cleansing. Sometimes crying can be helpful. Sometimes crying, is can be a hard thing too. And so some people cry easily, some people don't. Crying is not necessarily a sign of depression. It's important to tell your doctor if you feel that you're crying a lot more than you normally do, etc. Linda says making a gratitude list. That's essentially those pictures of flowers that I took today as I walked around um, in California. We were in Berkeley, walking around. I took pictures of flowers and little beautiful things because that was a gratitude list in a different way. And so finding the things that you can do that kind of help you, because we know that mental health often can impact our symptoms or how we're feeling. And so treated mental health is so much better than untreated mental health. I'm going to read a couple more of these points that I just thought were really helpful to know. Chronic pain can lead to mental health issues such as depression and anxiety due to the constant physical and emotional strain it places on an individual. And I know that sometimes pain comes hand in hand because of MS, and sometimes pain is not related to MS. But chronic pain is something it's important to work with your doctors, and in some cases you may even be connected to a therapist. I used to work with a lot of people that were living with chronic pain because it does put you at a higher risk for than for having depression or anxiety. So we have Cindy on here that says, giving yourself grace is much more difficult than giving some grace to others. Isn't that the truth? And Cindy says, I try to help at least 1 or 10 people daily at a nursing home, and it helps me probably more than it helps them. Yeah, that is so true. And probably giving yourself grace is so much more difficult than giving it to other people. And so it's important to know that it's not easy to do, but we honestly would give other people so much grace easier. But we also deserve grace for ourselves. So another point is the use of substances, both alcohol and drugs, can negatively impact both our physical and mental health. And this can cause, serious health problems. Now, I'm not saying that a glass of wine is bad, or going to, getting a beer at a brewery is bad, or whatever. But just knowing that the use of substances to deal with stress, etc., is not very helpful, and this can impact both your physical and mental health. Also, integrative approaches to health, which consider both physical and mental aspects of well-being are becoming very popular as a way to promote overall health and wellness. So this, I think, is a really important point, is that I love the integrative approaches. And many of you talk about this when you talk about yoga, when you talk about mindfulness, when you talk about relaxation tools, breathing, journaling, etc., because those things really overall help your emotional well-being, but that actually helps to promote overall wellness for you too. And so we're going to move on, and we're going to talk a little bit about when to worry about MS and mental health. So we're going to go 2 slides. So when you have mental health challenges that are occurring for long periods of time, they cause a significant distress or interfere with your daily functioning, it's probably time to seek help. I think it's also okay to normalize that if you have some stressful situations that come up that maybe are even short, that if or feels like that they're not as prolonged, but you're having a lot going on, there can be such thing as like an adjustment disorder. It's okay to seek help too. You don't have to do all of the things in life alone, and to get help with the coping and get help with the strategies can be very helpful. If mood swings are become kind of life altering, if you are experiencing any feelings of or thoughts of suicide, it's important immediately to contact your doctor, to go to call 911, call a suicide helpline. Depression occurs in nearly half the people with MS. So and anxiety, also affects about 50% of people in the MS population, either on its own or in conjunction with MS. So it's important to know that those things, if they're impacting your quality of life, changing how your interactions are, if you're noticing a difference, please, please, please talk to your healthcare provider. So we're going to move to our next slide. And we're going to talk a little bit about the iceberg that I always bring up. And emotional health tends to be underreported to your healthcare teams, and usually moods and mental health can interfere with sleep, treatment adherence, your roles in your life with like homework and relationships, quality of life, and those things do affect your physical health. And so we'll move on to our next slide. So discussing the importance of talking to your doctor is important because mental health, if it's diagnosed earlier, or mental health conditions, if they're diagnosed earlier, if you have coping strategies that can be addressed earlier, it kind of can help you on a more proactive level. And needing counseling doesn't have to be a bad thing at all. Dion put in there, thank you so much, Dion. And the suicide hotline is 988. So if you're experiencing any challenges, any suicidal thoughts, etc., the suicide hotline is 988. And so there's treatment options for managing many of the mental health challenges that one would experience, and those treatment options can include psychotherapy, medications, and lifestyle interventions. There's a lot of resources out there to support, and there also is a lot of like a really good understanding right now that mental health is a part of living with chronic disease, but specifically with MS too. So this is something that is becoming a little bit more normalized. Now, when I was first diagnosed about 20 years ago, the whole reason why I went into working with people that were living with MS was because I had a really hard time finding a therapist that knew about MS, that understood it, and understood that it was actually causing me a lot of emotional challenges. And we are in such a different place with talking about this now, which is incredible. So we'll move on to our next slide, and we're going to talk a little bit about managing MS-related mental health concerns. So, the first thing is, identifying it, getting some treatment, But really finding ways to manage and to cope. And the first step is talking with your doctor. And then, you may possibly be referred to a mental health therapist. And there's, there you may have a medication to take. There's a lot of different things that can be done. Um, but it's important to know that there are several, proactive steps that you can do that can help you with managing a any mental health concerns that you have. And I love the idea of what can I do today to support my mental wellness? Is it taking my medicine? Is it taking a walk? Is it exercising? Is it signing on to the mental wellness chat, etc.? So we're going to move on to coping strategies. So there are, definitely really good coping strategies that we can do, and to help cope with challenges. So one is, and I want you guys to chime in. What are things that you do to cope with mental health and challenges that you may have? What are your tools? What are in your toolbox? And so I think a good blanket of resources would be, coping strategies that help you to challenge unhelpful thoughts or negative thoughts, because what we tell ourselves is usually what we end up believing. And so sometimes learning how to reframe. We have Mona that said meditation and EFT tapping. There is such thing called tapping, which it can be very, very helpful when dealing with anxiety. Even at one point, goodness, I'm going to blank on his name. No, Prince Harry talked about tapping when he was feeling anxious. And a therapist can teach you those tools. Other coping strategies, may be getting social support. Also, stress management techniques. So using the things that help you to manage your stress is going to help you with learning how to cope. And Linda said, keep finding things that make you feel better. I like to sing, so I joined 2 classes. And I think that's great advice. I love art, so I've decided I just take art with me now. Dion says turning to someone's faith. So that is a coping mechanism too. Like, so turning to something bigger than you. And for some people, coping strategies may even be going to look in nature, looking, I know when I'm high stressed, sometimes I'll go to, there's a lake close to my house, and I'll go there and I will just sit at the lake and just look at all of the beautiful things. It's important to know that mental health symptoms can be treatable, through, medication, behavioral activation, which are the things that that you do, and cognitive therapy. So I want to remember someone, I don't know if you're on here today, but that we had someone a long time or a couple months ago share this thing called glimmering. And it was like practicing gratitude, except you just looked at all the little things that were just like positive, sweet, nice little things that made you happy throughout the day. Dion says mindful coloring, journaling, happening. Sherry says happening. So I might not be saying that right. And oh yeah, so Sherry's the one that said glimmering. So that stayed with me ever since you've said that, Sherry, and I've shared that with other people. So let's move on to we're going to go to the chat box side that I want you guys to participate in. What is something that you're going to take away from tonight's program? Linda says gardening makes me feel grounded. So I'll tell you what I'm going to take away. And Bill, if there's any way that you can put my my face back on the screen for just for the rest of the program, if it doesn't match up, I think everybody will forgive me. What do you do to cope? And I also want to ask you. So I'm going to look up happening up on YouTube, and I will share that at our next one. But what do you do to cope? Let's share what we do to cope. And and inspire each other, something that's different. And so we have mindful coloring, the journaling, the turning into your faith, the meditation, the tapping, reading, sometimes audiobooks for me, comedy, music. When I talk to others, gratitude is easy. I have MS, but there are many things I don't, and that is so true. The importance of extending grace to myself was a very great tip. I agree. Paula said movies. Stephanie says gardening, playing with my dogs, and chair Pilates on MSUs. Very good. It's a great class. And then Mona says, my takeaway is I have a community of people who understand me and have offered many tools to help me cope that I'm taking away. And one that I'm taking away is being in nature. And you are so right. You do have a community here, as you can see, even with just a little bit of sharing. Linda shared something about grief, and then I shared something about grief, and then Paula, I believe it was Paula. If it wasn't Paula, I'm sorry. And then someone else shared something about grief, and you start to realize that there's a community and that you're not alone in how you're feeling. So we have Dion says exercise, even if it's just for 10 minutes. Yeah, like reframing how we do things, letting us do a little bit of something. Small things make big differences. Carol says aquafit, walk and coffee with friends. Those are great. Paula said chatting with friends. Kania says a massage. And thank you, Paula. I thought that was you, but I never know. And plus, I'm Eastern time in my brain right now, and I'm like Western time in reality. So I'll be up later. So cognition maybe not be the best. Cindy says, in addition to feeling good when helping others, I think it's important to take/steal a bit of time for every now and again just for yourself. Absolutely. It is so incredibly important to take care of yourself, as equally as important to give yourself grace. And so maybe two things from this is, to think, what is something that I can do today, a small thing I can do that will support emotional wellness, and how can I be kind to myself today? And so with that said, I'm going to thank Viatris for today's program, thank Stuart from MS Views and News, and for helping me come up with this program and idea, and making sure that it has stayed for as long as it has, because I know that this helps people. And so we have Chris that says the next time is her infusion day. So that will be a good day for you then. Have your infusion, then come join us. Sherry said thank you, and Paula said thank you. So I always say this. This is a map in North Carolina, and I happen to be in California today. But I don't like to say goodbye, because I like to say we'll see you later. And I hope you know that you are a part of a big community of people that care. You are not walking this through this disease alone. And I so look forward to seeing you next month at the Mental Wellness Chat. And so with that said, have a wonderful evening.